Hi, I'm Kylie Moss. I'm an OBGYN at the Centers for Vulvovaginal Disorders, and I'm here with Dr. Melissa Mosgard. Melissa, do you want to introduce yourself?
Yeah, great. I'm Melissa Mosker. I'm a dermatologist here at UT Southwestern, and I have a co-appointment in the Department of Obstetrics and Gynecology. Here, I am the Director of Genital Dermatology and Women's Health, and I am so thrilled to be talking about all things vulva with you today.
Yeah, and we're going to focus on itch. So, itch is something that we both deal with a lot in our respective practices. And it's something that, science hasn't really caught up to all the symptoms patients have, but there are a lot of things we know about itch. And so, we're going to talk to you about what we know within the spectrum of OBGYN and dermatology of the genitalia today to kind of give you a sense of where to go if you have vulvar or vaginal itch. In reading about itch in the medical literature, you see that there are two pathways involved in itch, one of which is an acute pathway. So that's the kind of itch you get when you get a mosquito bite and things itch right away. And that's the receptors for that kind of itch are affected by histamine. So if you've ever had hives and taken Zyrtec, then that is an antihistamine medication, and it affects the itch receptor pathway that is affected by histamine. And then there's another itch receptor pathway that's more involved in chronic itch, and that receptor pathway is affected by lots of different things and involves a totally separate neurologic pathway. And it's a pathway that can get more sensitive the longer an itch persists. So for people who have experienced chronic itch, that is more the pathway that is affecting them. When we're thinking about itch from an OBGYN perspective, if patients come in, one of the first things that's really important to consider is the anatomy of the itch. Like, where are they experiencing itch? Itch can affect the vulva, the vagina. It can affect the labia minora, which are the small folds of skin just outside the vagina. And then it can also affect, oh yeah, look at the buffet. It can also affect the labia majora, which are further out, the darker purple areas on the buffet. It can affect the clitoral hood and the clitoris. And so knowing the anatomy is really important for us in terms of figuring out what is going on and what tests we might need to run to learn more about itch. So do you want to talk a little bit
Yeah,
more? Yeah, the derm perspective.
yeah, I was gonna say, in dermatology, we see patients that itch all the time. And we also break them up into several different types. So there's rashes that itch, and there's itches that produce rashes. So I think atopic dermatitis or eczema is a really good example of that. A lot of people have the itching first, and then they scratch, and then their skin is kind of broken down, and you see the rash that develops. There's also types of internal itching. So things that sometimes cause internal itching affect your blood or can affect your kidneys or other systems. And so that's something we see all the time. And then there's those acute, conditions like infections, inflammatory things like mosquito bites, like we were talking about earlier. So we definitely have to, take a step back and decide, what's going on? Can we see a rash that's causing itching, or do we need to dive a little deeper and see if there's other factors that are in play?
Yeah, one of the things I was reading about when I was, just like learning more about itch pathway, because this is not something that in like OBGYN training, we're like learning a lot about the different pathways of itch. One of the things I saw, and it always kind of perks up my interest, is that there's this endothelin factor, endothelin 1, that can affect itch, can be released from the lining of blood vessels. And I feel like when we're thinking about, at least in OBGYN, causes of itch and causes of symptoms in general, we often are very narrow in our focus and thinking about infections only. And
Canada, 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 Canada,
yes,
Canada.
yes, yeast and bacterial vaginosis, and like that's the end of the list. And I actually made an Instagram video about it a while ago because I was like, there are so many things on the differential diagnosis. When we're medical students, we learn so much about all of the different systems of the body that can be involved. If someone just comes in complaining of arm pain, we're thinking, did they break their arm? Do they have an injury to the arm? Do they have an infection? There's so many considerations. And I feel like vascular things are one of the things that are like a next frontier in vulvovaginal issues. Like we don't have a lot of things on the differential for like vascular reasons for itch, and so I think that's one of the things that like is where we could go in terms of the future. Like one of the things that we'll realize is more involved than we realize now. Do you have
Yeah, and
things
I
that you
think,
think we like future ways we should be going for like thinking about itch?
there's a lot of medicines that are coming out that are approved in certain situations, like itch related to kidney disease, for instance, because
Yeah.
patients on dialysis have just really horrific itching, actually. Um, And so, whether we can use these things in different circumstances, I don't know. There's also some new injectable medicines. Dupilumab is one of them
Yeah.
that we prurigo nodularis in dermatology, but it
Yeah.
has a ton of other uses. That one was just FDA approved. I've used it in some patients that have really severe atopic dermatitis and also have very severe lichen simplex chronicus on the vulva, that it's worked very well for. These are all
Yeah.
off-label uses, but
Yeah.
the only way we can get things on label is to use them and
Figure it out.
report them in the literature and hopefully get our patients better. But I'm
Yeah.
so thankful to be doing this with you because I think it'll be really nice. We kind of talked a little bit about the overview of itch, and then I think diving into a little bit of the causes of maybe vaginal itching and then other causes of vulvar itching. So I think it's going to be a lot of fun.
Yeah, I agree. Okay, well, we'll take a break and then we'll come and talk more about the specific causes.